Anthony.
How are you?
I'm doing well. How are you?
I'm doing great.
Thank you for coming in today.
Mm-hmm.
So I was speaking with your PCP, and it looks like you were recently diagnosed with pre-diabetes.
Yes.
Correct. Okay. Excuse me while I just take a couple of notes here. So I just want to get caught up. Okay. So I saw that pre-diabetes screening came back positive. And were you at the doctor for any particular reason, or were you just getting like an annual exam and they
Just
happened to
annual.
find that?
Yep.
Okay, so it was just like happenstance that your labs came back slightly abnormal.
Yep.
Okay. So luckily you're not in the diabetes range.
Okay.
So right now there's no need for you to get on any sort of insulin or metformin, which would be like an insulin controlling medication.
Okay.
You are at the very beginning stages of pre-diabetes, so it's good that we caught it early.
Yep.
Can you just tell me a little bit about your family history? Does anyone in your immediate family have diabetes, like your parents, your siblings, grandparents?
Grandparents, yeah.
Grandparents. Yep. And do you know if it's type 1 or type 2 diabetes?
No, I'm not sure off the top of my head.
Okay. So it's likely type 2 if you
Yeah.
weren't diagnosed early on in life.
Yeah.
Okay, so we can usually try to control that with a change in diet or
Okay.
healthy exercising habits. I did see that you exercise pretty
Yeah.
frequently. Do you tend to eat a normally healthy diet, or?
I guess I would say so. I think there's definitely like the fast food and then
Okay.
I am a fan of the candy.
Candy. Okay. And when you got your labs taken at your last doctor's appointment, was it fasted? Like you had not eaten anything,
Yes.
correct? Okay. Okay, so I did have the nurse take your blood sugar earlier,
Okay.
and it was within normal limits this morning, and you said this morning all you had was your normal coffee,
Yep.
right? And it had creamer in it?
Yep.
Okay. And do you know that creamer contains sugar? It's like a flavored creamer?
I am sure it does.
Okay, so
yeah.
there was sugar in there. So the fact that your glucose level still came back normal this morning is a good sign.
Okay.
So I will notate that. Okay. So if you could, I would like you to just tell me what a typical breakfast looks like for you. So include your coffee. How much creamer would you say? Do you normally measure, or do you typically just kind of pour it until
Hand pour until,
pour?
yeah. I like it sweet.
Okay. And do you add sugar as well, or just flavored creamer?
I add sugar.
You also add sugar. Okay.
Yeah.
And what do you typically eat for breakfast?
I think it depends. It's either oatmeal, but I do like brown sugars or like regular sugar in my oatmeal, or it's a bowl of cereal. It can be anything from like a raisin bran
Okay.
with sugar.
So you add sugar to cereal as well?
Yes, so it depends. Yeah, or it's like a fruitier cereal.
Okay,
you know
so
what I mean?
just depending on what it is.
I like it sweet.
Okay.
Yeah.
And how about, do you typically eat lunch?
Sometimes. I would say probably like 60% of the time. 70%
Okay,
of the
so-
time. Yeah, most of the time.
Okay.
Yeah.
And for lunch, are you having like a fully cooked meal or like a sandwich?
Mostly sandwiches. It's usually just chicken on bread, though.
Chicken.
Yeah, nothing too
Okay.
crazy.
And what about your dinner?
That can be all over the place, honestly. It's usually heavier. It's either like more chicken or like steak and
Okay.
like rice, things like
So
that.
you're definitely getting your protein
Yeah.
in. Do you usually have dessert? Are you a dessert person?
Mm-mm.
Not
No,
usually.
No.
Okay. So it looks like the bulk of our carb and sugar intake is coming from
Yeah.
breakfast.
For sure.
So you're relatively active. You're very young. You work out several times a week. It sounds like your dinners are on the healthier side, and then your lunches, when you do eat them, aren't terrible.
Yeah.
So I would guess it's mostly breakfast,
Yeah, for sure.
coffee, and snacking.
Yeah.
Some people just are more predisposed to be diagnosed with diabetes if it runs in your family, but obviously there are things we can do to kind of combat that. And then obviously the last resort we would want is to have to put you on medication.
Yep.
So we'll go over kind of some of the risk factors of an official diabetes diagnosis. But in
Okay.
the meantime, I would like to just give you a couple pointers on what you could do to change your diet up slightly that could make a big difference, especially that first meal really kind of set the tone for your metabolism and for your insulin structure for the day.
Okay.
So it is very important. I know it's easy to kind of grab and go with the cereal, but we should try to work on that a little bit if we can, okay? So for your coffee, I get it. Coffee sets the tone for the day, so I'm not going to ask you to completely change your cup of coffee. I would like to see you try to scale back a little bit.
Okay.
So if we could maybe try a sugar-free option in the creamer. A lot of people don't tend to like sugar-free creamer, so if nothing else, I would maybe just start to measure it so that you're more aware of how much you're putting in there, because the problem is with the pouring, you don't realize how much of it you're actually putting in. So what I would like you to try to do is for an entire week, when you make your coffee, instead of pouring it in, use a measuring spoon, so just like a regular tablespoon, and I want you to put in the same amount that you would put in as you pour it. So do 1 spoon at a time, and then taste it until it tastes how it normally would, and then count how many tablespoons of creamer it took for you to get there, as well as sugar. So that kind of gives you a good visualization of how much you're actually putting in your coffee, and that might be a good starting point for you, because you're probably going to realize that you're putting quite a bit in there. So coffee creamer servings is generally 3 tablespoons. If you like it on the sweeter side, you're probably looking at closer to 5. I would like you to eventually eliminate the added sugar altogether, because flavored creamer is already pretty high in sugar. So let's work on just kind of scaling back, measure it, see how that goes. You can document it if need be, and that might help you keep track of it a little bit better. And then for your breakfast options, cereal isn't always the worst option. It can get a little high in sugar if we're adding sugar to it, especially if it's already has sugar in it. So I would recommend something like maybe Raisin Bran without adding sugar. Something like a Special K tends to be lower in sugar. We also have to consider with diabetes, it's not just sugar intake, it's also carb intake. So the problem with cereal is that it's a carb, right? So you're having a starch and then you're having added sugar to that. So it's kind of like a double whammy, and it's a lot. So it spikes your insulin really quick, and then it drops it down really fast. So then you kind of get into the snacking cycle, and it messes with your metabolism. Because it doesn't keep you full. So oatmeal is very good for you, high in fiber. It is also a carb, but it's a steady carb, so it kind of keeps you fuller longer, helps keep your metabolism steady, and doesn't spike your insulin as frequently. So that's something that I would consider having more frequently. Obviously, people usually tend to add like brown sugar to their oatmeal, butter, which is okay. Again, we just want to measure and keep it in moderation. So 2 to 3 teaspoons is what I would recommend for sugar in your oatmeal. And then think about adding more complex carbs. So maybe instead of adding refined sugars, like a fruit, you can add raisins, dried cranberries, that kind of thing. That way you're still getting the sweetness, but it's coming from a more natural derivative. And then you can also consider honey, which is obviously still sugar, but it is slightly better for your glucose intake than like a regular white or brown refined sugar.
Definitely. I think I just like it sweet, and I think
absolutely. It's a habit thing too. So what I used to do is I would drink juice, like I'm a big cranberry juice drinker, and I used to just pour a glass of cranberry juice and I would drink it, and I started to water it down. And now if I were to try to drink a glass of cranberry juice, it would probably be way too sweet for me. So you kind of get accustomed to the sweetness, and then your tolerance builds up just like with anything else. So if you start to cut back a little bit, eventually those things will become too sweet for you and you won't like it anymore. So it's just a matter of breaking that habit. So I don't think you'll have too much trouble. Try to make small changes, but the rest of your meals throughout the day look fine, and you are fairly active, like I said, okay? So let's go ahead and get started with the physical portion of the examination. I'm just going to be putting a pair of gloves on, and I will be touching your lower legs and your feet. Do you have any pain or discomfort in your legs or feet right now?
No.
Okay. Have you noticed any signs of neuropathy, which would be like a tingling or pins and needles kind of sensation, like when your limbs fall asleep and you feel that tingling, almost like static-y feel?
No.
Okay. How about any loss of sensation, any numbness?
No.
Okay. You don't ever hit your foot and then realize you've damaged your nail beds, but you didn't notice until you saw it, that kind of thing?
No.
Okay. And then do you have any issues with poor circulation? Are your toes typically colder than the rest of your feet, or do you find that you have to wear socks a lot?
I think they're pretty normal, yeah.
Pretty normal circulation. Okay, perfect. So I have just a regular Penlight here, and I'm just gonna have a look at your skin to begin, okay? So for now, I'm just looking at the overall integrity of your skin, making sure that everything is intact. Diabetes can result in excess dryness of the skin, so that's something that we would want to look out for, but I'm not noticing that here. Your skin appears well moisturized. Another thing we see frequently with diabetes is hair loss in the lower extremities. So when I remove your socks, I'll have a closer look at that, but so far, hair does appear evenly distributed. I'm not seeing any patches of loss. Very good. Okay. I'm just looking at the integrity of your skin overall. Good, okay. So I'm gonna go ahead and pull your socks down to the ankle for now. Okay. And again, hair growth is normal throughout. Typically with diabetes, we start to see hair loss in this area, and I'm not seeing that for you, so we are okay there. Also not seeing any signs of discoloration, no darkening of the skin or hyperpigmentation, no signs of gout.
What's gout?
Gout is a fungal disease that can affect your lower extremities, sometimes in the hands, but we mostly see it here and in your toes. Yeah. So, patients who are diabetic have a higher risk for infection, so I tend to see them kind of coincide. A lot of my patients who have had type 2 diabetes for a long time tend to develop gout over time. So it's kind of an inflammatory disease, but I'm not seeing any signs of that here. No edema of the lower extremities, no pitting. I'm going to do just a slight pushing just to see,
So like when it doesn't,
check
like,
for
come back up.
reactivity. Yes.
Yep.
So if you had what we would call pitted edema, which is the worst stage of swelling that you can have, we typically see that in the lower extremities or the legs. If I were to push in and release, we would get a very slow release, if none at all. I've had patients where it's so bad that you push in and it leaves a dent, and that's in the swelling, and it takes a couple minutes to come back up, and that's when we're looking at a bigger problem, because it can lead to really severe repercussions. Unfortunately, a lot of people have to have their limbs amputated if it gets that severe. So no signs of that for you, luckily. Okay, so let's go ahead and remove your socks. And I did already have a look at your tennis shoes, and they are very evenly worn. I didn't see any signs of abnormal wear and tear. There doesn't appear to be any wasting to one side, or it doesn't appear as if one shoe is being worn more than the other. So that's very good. Do you typically have any issues with your gait or with walking? Are you able to walk normally?
Yeah, I think so, yeah.
Okay. Good. So skin looks healthy and well hydrated. Color is normal for ethnicity and age. I'm not seeing any signs of discoloration. Very good. Okay. So the nail beds appear healthy. No signs of any sort of fungal infection, and nails are well groomed, which is very important. No signs of excess dryness. So I'm going to be checking for capillary refill, which is just a test where I push down on the nail bed and the bottom of the toe, and that's going to occlude your blood flow, and it should come back within 1 to 2 seconds if we have normal return. So I am seeing that here. So if you can see, I push down and it turns white.
Yep.
And I release and it immediately returns to pink, which is what we want to see.
Yep.
Very good. Another way to test that is by squeezing the bottom of the foot, and again we see the white and then pink immediately returns. So very good. I am getting less than 1 second return, which I would consider a 2+ reaction. So very good there. The next thing I'm going to do is have a look in between your toes. So sometimes we can miss this area. It tends to be kind of a hot spot for fungus and bacteria to build up. A lot of people don't wash between their toes. So it is very important to keep up with proper hygiene. Very good. So just going to look underneath the toes. And can I ask you what size shoe you wear?
13.
Okay.
Yep.
And you feel like that fits you properly?
Yeah, 100%.
Okay. How long have you been at that shoe size? Has it changed recently, or it's been the same for a while?
At least the last, I would say, 7 or 8 years.
Okay.
I hit my last growth spurt in like 2015.
Okay. So plantar side of the feet appears healthy. Skin is smooth. No signs of excess calluses. Okay. You are slightly flat-footed. You don't have a very high arch at all. Does that ever cause you any lower back pain?
I want to say no. I don't think so.
Okay.
Nah, I don't think so at all. I think I wore like the proper shoes for that. You know, there's certain shoes that I can't wear. Like,
Okay.
You know, just so flat.
So I'm going to lift your foot and have a look at your heel, and I'm just looking for any loss of integrity of the skin. You're very young, so I'm not expecting to see any signs of pressure injury, but it is important to check.
Yep.
Okay. All right, well, let's go ahead and move on to the next portion of our exam, and that is going to be just checking for symmetry between the two extremities. So I'm going to be taking measurements and just making sure that we are relatively equal on both sides. No one has perfect measurements, but we definitely don't want to see that, you know, one leg is 4 inches longer than the other or something like that. So it is important that we check. Thank you. And definitely want to measure the feet themselves, because I have actually found that some of my patients wear 2 different size shoes. Very good. Okay. Let me just take a couple notes here, catch up on my documentation. So measurements are all within normal limits. Reasonable symmetry between the 2 sides. Okay, so no signs of any edema in the lower extremities. Okay. Alright. Very good. Do you see one mole that I might want to have a closer look at there?
Yep.
Okay. Have you always had this mole?
I want to say yes, but you know, I was like, I can't remember.
We just want to keep track, make sure that we're not having any frequently appearing moles, any that are kind of abnormal in shape or size. So just for your own personal reference, what we look for with moles that could be suspicious or that we might want to be more cautious of is if they're asymmetrical in shape. So typically round is safe, not always, but for the most part. So if we have undefined borders or undefined edges or edges that change in shape, if you have any moles on your body that you notice look differently than they did before, you definitely want to get them checked out. Any that are raised to the touch, so if you kind of move your hand over it and you can feel it, sometimes that can be an indication that something could be wrong, not always. So this one is flat, and you also want to look at color. So brown, light brown, even like a creamy color to a dark brown is usually safe. Black, red, those can sometimes be indicators that something else could be happening, but that one looks okay, and then you have a very small freckle there, and that looks okay. Very good. Okay. So I'm going to do something that might be slightly uncomfortable. I'm just going to tug on the hair, and I'm just checking for integrity of the follicle. Make sure that your hair is not like falling out abnormally. It should be able to withstand a slight amount of pressure. I do apologize. I know this can be uncomfortable.
I think we can get it stuck this time.
Yes. Okay, so I'm going to have a look at your veins. I'm just looking for healthy perfusion, good blood flow, and good return. So when I run my fingers over them, I want to see that they're reacting normally. Okay. Good. Okay, so now I am going to have a listen to your feet, which I know might seem a little odd, but just listening for good blood flow. And I will also be able to hear your pedal pulse. Very good. So I'm going to place this on the bottom side of your knee here. Very good. And I'll do the other side. Very good. Okay, so no signs of any lack of blood flow or lack of oxygenation in the lower extremities, so that is very good. Okay. The next thing I'm going to do is just do some more symmetry testing. So I have a couple different tools here. So this is a ruler. It's called an Archies, and it just helps me check the arch in your foot. I can already tell just visually that you don't have much of an arch, but I still do want to just have a look. Okay. So you are about a grade 3 flat foot. So essentially I use the different sections of this ruler to grade how flat your feet are or how arched your feet are. So we do have patients whose arch is too high and whose arch is too flat. So you're at about a grade 3, 3.5, but it's nothing that I would consider detrimental to your posture or anything like that. You do have a slight arch. It's just more shallow than what I would consider average. But since you're not having any symptoms of like acute back pain or anything like that, it doesn't seem to be causing you too many problems. I didn't see that you have a history of scoliosis or anything like that, so I'm not particularly concerned. I would say that as far as shoe branding, you're probably going to do better in something like an Asics or a New Balance. If you can, I would stay away from things like Vans, Converse, even some Nike shoes can be not great for flat feet. So
I stopped wearing like the Chuck Taylors. It's just like the most uncomfortable.
So those are probably the worst for your feet, as well as Vans, especially the slip-on Vans.
Yeah, so flat.
Asics is a really good brand for both high arch and low arch, but they do have specifically flat-footed shoes, and so does New Balance.
Okay,
so
cool.
definitely keep that in mind. Okay. There's also a new brand called out, I believe it's called Hoka. A lot of my patients say that they have good luck with those. They're like a little bit of a bulkier shoe, but... Okay. So this is called a caliper, and I'm going to use it to test for symmetry between the 2 feet. So just kind of measure one side, and then we can compare that directly to the other side, and this just helps us check for any abnormalities between the 2 feet. So we do have a slight difference here. Okay. Really only seeing a difference here. It looks like your bone is just slightly more prominent on this side.
Yeah, I think I've noticed that too throughout the years.
Is that something that you've noticed has shifted?
Well, I run a lot.
Do you?
Yeah,
okay.
And I don't know if it's TMI, but like, my mom had like bunions and things like that.
Absolutely, that's good to know because it can be hereditary.
So I think that's what it was. So they didn't look like too severe or anything like that, but I think the years of like running, I used to wrestle as a kid, so I think there's some wear and tear on my feet.
Okay.
So.
Did your mom ever have corrective surgery? She did.
Yeah,
okay,
she
so
did.
hers was severe enough to where she had to have corrective surgery. Okay. So yours is not there, fortunately. Unfortunately, bunions too tend to get worse with age. So what I would recommend is being very selective with your shoe choice because while bunions can be genetic, essentially what happens is if you picture a normal modern day shoe, let's say Converse, they're very narrow at the tip of the shoe. So they kind of go in and they force your feet to be shaped like this. And what happens is it forces your big toe inwards and this bone becomes more prominent. So we want shoes that are allowing your natural foot to kind of sit as it should. So that's a new thing with like barefoot shoes.
I've seen that.
Yes.
I was say that.
So they're a lot wider at the base of the foot. Think of something like the shape of a Croc. Crocs are not a shoe that I would recommend for your feet overall. They're just not very good for the integrity of your feet altogether, especially for a diabetic. But as far as the shape of the shoe, that's more so what a natural foot is shaped like. So if you've ever put your foot in a Croc, you can tell that you have quite a bit more room in there, and that's really what we should be looking for in our shoes, okay? So
I think
nothing that I would consider like emergent or in need of surgery or anything like that, but definitely something to keep an eye on because I do see a difference between this one and this one. And you are right-handed, correct?
Yes.
You are. Okay. So that's something that we can kind of consider too. This is your dominant side, which probably means when you're walking, you're overcompensating a little bit with your right foot. Yeah. So see some slight irritation here where it's likely just been rubbing on your shoe.
Like moleskin there.
Yeah. So as far as your hygiene practices, how frequently do you shower? And this is not, I'm not judging you in any way, I'm just trying to gain an understanding.
I'd say once or twice a day at least.
Once or twice
no more than twice a day though. It depends on if I go to the gym.
Okay, so if the days that you work out, typically you're showering twice. Okay, perfect. So it's kind of difficult to explain. So we want you to shower enough to where you're keeping away sweat, moisture, bacteria, any kind of fungus, things like that. We don't want you to shower so much that you're drying out your skin to the extreme where now we're looking at issues like cracked skin, cracked heels, because that puts you at a higher risk for diabetic ulcers, which is something that we will talk about. So when you shower the days that you go to the gym, do you shower at the gym?
I would say more often than not I shower at home. I would say 70 to 80% of the time at home.
Okay, so there are few and far between that you do shower at the gym.
Yeah.
When you do you wear shoes in the shower?
No, I don't.
Okay.
Yeah.
So that's something that I really would like to discourage.
Okay.
It's okay if you're showering at the gym, but you absolutely must be wearing some type of sandal. The reason for that is gym showers do not get cleaned in between each person.
Okay.
Sometimes they don't even get cleaned every day, so you have to think about what other people might be bringing into the shower.
Okay.
It's a moist, oftentimes warm area. Tile is porous, so it can hold fungus, bacteria, that kind of thing. And obviously right now you're not in the diabetes stage, but as we might be looking towards that in the future, we want to kind of prevent some of these injuries that could happen.
Okay.
So it's always easier to prevent than it is to treat after you have a diagnosis. So just a simple pair of cheap flip-flops. It doesn't have to be anything super expensive. I know I said I don't want you to wear Crocs, but if you wear them in the shower, that's totally fine. If you buy like I think it's like the Everyday Croc or something, those are a good shower shoe because they're made of plastic. Just make sure you're only wearing them in the shower and that you're letting them dry completely in between uses. You don't want to ever have your feet in something that's just constantly wet.
Makes sense.
Okay. So do you find that your feet get like overly sweaty throughout the day, or do you feel like your current shoes and socks keep your feet pretty dry?
Pretty dry.
Okay.
Yeah.
Very good. So no excess sweating, and I'm not noticing any excess perspiring today. So that's definitely something that you want to keep track of. It's very important to keep your feet dry and cool, especially kind of in between the toes.
Yeah, makes sense.
Alright, so let's go ahead and get started with a different portion of the exam here. I'm going to just bring this down. So I want to do some sensation testing, and this is to rule out any kind of signs of neuropathy or sensation loss. I don't suspect that you're going to have any of that today, but let's go ahead and test so that we can get a baseline, and then we can retest you in a year and see if you've declined at all, okay? So the first thing I'm going to do is fairly simple. I have just a cotton swab here. So are you able to feel this?
Yeah.
Can you feel that it's pretty soft?
Mm-hmm.
Okay. So I want you to close your eyes for me. I'm going to touch you in various places on your legs and feet, and I want you to just say yes when you feel it, okay?
Yes. Feel it. Feel it. Feel it. Feel it. Yep. 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 Feel it. Feel it.
Very good. Okay, so the other side of the stick is a little more pointy.
Mm-hmm.
Are you able to feel that?
Yes.
Okay, so just say yes if you feel it.
Yes. 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 Yes.
Good. So now I'm going to use both sides, and I want you to tell me if you feel sharp or dull.
Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp.
Very good. So no discrepancy there. So let's move on to a different tool. And this time it's going to be a little different. I have kind of a soft, spongy material here. I'm going to run it down the length of your leg and foot. I want you to tell me if at any point it starts to feel any less intense, okay? So does that feel the same all the way to the bottom?
Yep. Same. 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 Same.
And no difference between the bottom here and the bottom here,
Nope.
and here in here.
Same.
Very good. Okay, so I have another tool here. This is actually an acupressure tool, but it is kind of cold to the touch. So I'm going to be just testing for any difference in between the feeling between your toes. So you don't have to close your eyes. Just let me know if this feels the same. No difference underneath.
Feels the same.
And no difference comparatively from one side to the other. It all feels the same. Perfect. So let's do something a little different. I have two different tools here. They both have kind of a sharp exterior, so it's not going to hurt you or puncture your skin, but it is pretty distinct.
Yeah.
This one is just very, very small. Tickles a little bit?
Yeah.
Okay. Can you feel the difference between these two?
Yes.
Okay. So if we call this one 1 and we call this one 2, I want you to just tell me what you feel with your eyes closed, and this will be only on your feet, okay?
Yep. 1.
Good.
2. 2. 1. 2. 2. 2. 1. 1. 1. 2. 1. 1. 1. 2. 2. 2. 1.
Very good. Okay. So no issues with that. Very good. Okay, so let me just bring these tools down. So this test is going to help completely rule out any neuropathy. So I have a brush here and it's pretty wiry, and patients who have neuropathy typically feel pain when they feel brushing sensations on their lower extremities. So from the knee up, this should feel okay. Just feels like a normal brush. I want you to close your eyes and tell me if at any point I swipe this along your legs and feet, you feel like a burning or hot sensation, okay?
Yep.
Okay. So no abnormal stinging or burning or anything like that, especially here on the kind of, okay. Good. Okay. So that is ruling out our kind of acute polyneuropathy. Last thing I want to do to test sensation is cold. So this is pretty cold. I want you to just say yes if you feel it, okay?
Yep. Feel it. Feel it. Yep. 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 Feel it. Feel it. Yep. Feel it. Feel it. Yep. Feel it. Feel it. Yep. Yep.
Very good, okay. And that didn't feel any different temperature-wise everywhere you go.
Yeah.
And this feels warm to you compared to that?
Yeah.
Okay. Good. So your sensation test was completely normal. No loss of sensation at all, which is very good. So the reason we would be concerned, obviously if you're unable to feel something, you're more likely to injure yourself, especially your feet, because you're not typically looking down as you're walking. So I would hate for you to step on something sharp. So the biggest issue with diabetic patients is injury to the foot. Anytime there's a loss of integrity to the skin, which would mean an open cut or open wound area, there's an opening for bacteria to get inside, which is what leads to things like diabetic foot ulcers, and obviously worst case scenario would be amputation. So it's definitely a good idea to keep good, intact, well moisturized skin. So overly dry, cracked heels can sometimes split open and cause fissures, so we want to prevent that. If you had overly callous skin, then we would maybe be looking at something like a medical pedicure. Don't recommend going to a regular pedicurist if you have diabetes, just because tools may not be sanitized properly. Something like a medical pedicure where they sterilize the tools would be more efficient for you, but you don't really need that at this stage, just something to keep in mind. So the next thing I'm going to do is just do some light percussing on different areas of your feet, okay? And this is just testing for normal reactivity in your muscles, so I'm looking for that jerking motion. Any pain here?
No.
Good. Good. So I'm going to have you lift your foot. And I want you to rest your weight in my hand.
Okay.
Very good. Okay.
So if someone their foot wouldn't move as much?
Yes, or we would get an overreaction. So sometimes you'll have a complete twitching of the foot, which can indicate a neurological problem.
Okay.
So we just want to rule that out. But you had a very normal, mild jerking, which is what we're looking for. Okay, so we'll lift your foot. Very good. Okay. So the next test I'm going to do is called the Babinski reflex.
Okay.
And I'm going to rub the bottom of this tool up your foot, which can be uncomfortable. We're looking for a normal neurological reaction. Very good. Very good. So that curling of the foot is what we're looking for. If there was a lack of reaction, it could indicate a neurological dysfunction. If there's an overreaction, then we might be looking at a different problem. But your reaction was totally normal. And lastly, just looking for mobility in the toes. So you see how this kind of slightly forces your toe to flex. We're looking for normal mobility. Big toe tends to flex a little less. If you were more rigid or your joints were more stiff, then I might recommend some toe stretching, but you're okay. You're pretty flexible here. Okay. All right, well, let me go ahead and catch up on my notes. As far as I'm concerned, you are completely healthy. These are things that we want to kind of keep track of just as a preventative measure. So making sure that you're wearing shoes, try not to walk around barefooted if possible. Especially outside where there might be things that you could step on that you're unaware of. In the house, if you can, I would recommend wearing some type of slipper or loafer. Definitely in the gym shower, you want to be wearing shoes.
I used to, and I stopped, and then I was like, I don't like to stop. So.
Okay. All right, Anthony. Well, I am going to give you a clean bill of health as far as your lower extremities are concerned. I would like to see you back in a year. I would assume by then you would already have seen your PCP. They can get your labs redone, and we will retest your A1C, which is what tells us whether or not you are diabetic. In the meantime, unless you have any other concerns or should anything come up, if you have a deep cut on your feet and you'd like to have it looked at, definitely recommend you come in. But other than that, we should see you in about a year.
Definitely.
Okay? Thank you so much. It was very nice to meet you.
Nice to meet you too.
Take care.
You too.